So this is a very simple technique, just to spread and descend the tissue of the erector spinae as part of the urinary bladder sinew channel. A couple of considerations though, is as we're spreading down the urinary bladder line, when we get to the iliac crest, we have a couple options. If the patient has an elevated ilium, let me hike your ilium up, we might work along the iliac crest to be able to descend that tissue, but also to help push the ilium down. In addition, if they had a posterior tilt, moving from medial to lateral will help sort of put the tissue back into a place that'll take them into an anterior tilt. So either posterior tilt or ilium elevation, I can take that tissue then from a medial to a lateral position. If they have an anterior tilt, I might gently come over the ilium, just being sure not to push into the bone, and then descend down through the fascia over the sacrum. We're going to find a good starting place somewhere around the inferior angle of the scapula. I want to be careful not to dig my elbow into the spine, but I'm going to be pretty close to the lamina. But the bulk of the pressure is going to be along the urinary bladder line. Sink in, and then slowly spreading downward. Patient movement, they can just gently take a nice deep breath and breathe into the pressure and exhale. Again, when I get closer to the ilium, that's when I need to make a decision based on my assessment to either spread along the top of the iliac crest going medial to lateral, or in this case, I think I'm going to be careful not to dig my elbow into the bone, but I'm just going to continue downward to take the pelvis or influence the pelvis into a posterior tilt. And I can have the patient slowly tuck the pelvis under and relax. One more time, don't contract the glutes, just try to slowly, just a little bit tuck under. Yeah, there you go. And that feels like a good place to exit.